The Mental Health Authority says it is unable to rid the streets of itinerant mentally challenged persons due to lack of funds. It says government support has not been forthcoming, hence a failure to render effective mental health care.
The World Health Organization estimates that about 650,000 people suffer from severe mental disorder, and a further 2,166,000 are suffering from moderate to mild mental disorder. Mental disorders range from stress, anxiety and depression, psychosis and schizophrenia. The Mental Health Authority is currently crippled in its effort to care adequately for patients due to infrastructure deficits and lack of funds. The absence of a legislative instrument has stalled the implementation of the mental health law.
The rehab center that was running, there's one in Elmina, but has run down. It was supposed to be running as a rehabilitation center for persons who have been discharged, for instance, from acute care from the hospitals, and then they go there, like I said, they are rehabilitated, they are able to fend for themselves, and then they are sent back to their families. But we have some rehabilitation centers in the hospitals, but those are largely for, let's say, people with addiction, for substance use. Those ones are currently there, but even then, there's no funding. So when people come, they need to pay. They pay between 800 Ghana cedis and 1,200 Ghana cedis. But the law says mental health is free, so they are not supposed to pay. So sometimes we have challenges when people come and they cannot pay, and you still cannot turn them away.
Deputy Chief Executive Officer of the Mental Health Authority of Ghana, Dr. Caroline Amisa, said activities of the authority has been funded by the Department for International Development, DFID, of the United Kingdom. She appealed to the government to establish the mental health levy.
I think we will continue to plead with government for them to make mental health a priority. I know that the political will is there to support mental health, but then we need to recognize that it has to be budgeted for.
The acting clinical coordinator at the Pantang Hospital, Dr. Julius Zache, admits that although the hospital is in dire need of support, it tries to meet the needs of the public.
Pantang Hospital is working on how to get mental health care even to the persons who are in their homes as well. We are doing that in collaboration with the community psychiatric nurses. We also have another project that has been captioned Setting the Captives Free, whereby persons who have been mentally unwell for a very long time, we pick them up from the streets, we treat them ourselves and rehabilitate them, and then find a way to unify them or get them back.
To aid the prevention of mental illness, the Meridian Ghana Conference of the Seventh-day Adventist Church launched a book titled The Power of Hope, which provides some guidelines on how one can overcome depression, anxiety and stress. The book was distributed for free.